Welcome to The Deep Dive. Today, we're looking at something that could, well, potentially rewrite what you thought you knew about heart health. For decades, the message has been pretty clear, right? High cholesterol, especially things like LDL-C and ApoB, well, that equals a higher chance of cardiovascular trouble.
Yeah, absolutely. It's been the foundation, really, the lipid hypothesis.
Exactly. But what if, new research came along and started to shake things up a bit?
And that's precisely what we're digging into today. We've got some really fascinating new findings.
Yeah.
They come from a study in the Journal of the American College of Cardiology, advances by researchers at the Lundquist Institute that's at Harbor-UCLA Medical Center, and also some insights from a year-long prospective study.
Right.
And taken together, these sources really make you question that straightforward link we've always assumed.
Yeah.
Particularly for certain people.
Which people are we talking about? Because it's not just cholesterol in general, is it?
No, not at all. This research really zoomed in on a specific group, people who are actually, metabolically healthy.
Okay.
But they happen to have high cholesterol, and it seems to be because they've been on a long-term ketogenic diet.
Right, okay. So let's unpack that. Metabolically healthy, keto diet, high cholesterol. Tell us more about who these individuals actually are.
Sure. So the study followed 100 adults. Key point, metabolically healthy.
Got it.
They'd been on a low-carb keto diet for quite a while, average of 5 years. And yeah, as a result, their LDL cholesterol went up.
Okay.
But what's really interesting is how they defined metabolically healthy. They use this term, lean mass hyperresponders.
Yeah.
LMHRs.
LMHRs. Okay, I've heard that term. So what does that mean practically? What makes them different?
Well, think about it like this.
Yeah.
These people have the high LDL-C and ApoB. Those are the numbers that usually set off alarm bells, right?
Definitely.
But when you look at everything else, their other metabolic markers are, excellent.
What's that?
Okay, so low triglycerides, high HDL, that's the good cholesterol, low blood pressure, and really low insulin resistance, which is great, means their body handles sugar well. Plus, a healthy BMI.
So if you just glanced at the LDL, you might worry.
Exactly. But the bigger picture, it looks quite healthy.
And crucially, the study pointed out that these LMHR individuals didn't show signs of existing heart disease at the start.
That's right. No evidence of baseline coronary artery disease.
And that didn't change over the year they were followed.
No, that stayed the same.
Yeah.
No disease progression spotted during the study period.
Okay, so here's where it gets really interesting then. What did the researchers actually find when they compared those super high cholesterol levels to, what was happening inside their arteries?
Well, this is the core finding, and it's pretty remarkable. They found zero link, no correlation between atherosclerosis, that's the plaque buildup in the arteries,
Right.
and these extremely high cholesterol levels, specifically in this metabolically healthy group.
Wow, zero link.
Zero. And furthermore, and this is really key, they found no association between plaque progression, whether it got worse, and basically anything to do with the ApoB or LDL-C. Not the total exposure over time, not any changes in the levels, not even the starting levels.
Okay, hold on. So the very markers, the LDL, the ApoB, that we're constantly told to lower,
Yeah.
they weren't predicting or driving plaque getting worse in these specific people?
That's what this study suggests. It really does challenge that prevailing lipid hypothesis, doesn't it?
Yeah.
At least, in this context. For these LMHR individuals.
So for someone listening who's maybe been religiously tracking their LDL, what's the critical takeaway here? Is LDL irrelevant now?
Oh, no, not necessarily relevant for everyone. The crucial nuance is that in these metabolically healthy individuals whose high cholesterol seems tied to this specific diet, well, the traditional risk assessment using just those numbers might not be the full story. It might not be accurate for them.
Okay, that makes sense. It's about the context. But wasn't there something else the study found that did predict plaque progression?
Yes, absolutely. While the cholesterol levels weren't the predictor in this group, something else was.
What was that?
It was the amount of plaque they already had at the very beginning of the study. The baseline plaque burden.
Ah, okay.
That turned out to be the strongest predictor of whether more plaque would build up later on. Plaque begets plaque, as the study title implies.
So if the cholesterol numbers aren't the best guide for this LMHR group, what does that mean practically? What should they do?
Well, that's the important question, isn't it? The researchers suggest that maybe for this specific population, we need different tools.
Like what?
Like perhaps prioritizing actually looking at the arteries directly. Using cardiac imaging to see the baseline plaque burden, that might give a much clearer picture of the actual risk.
That makes a lot of sense, especially now. You see so many people adopting ketogenic diets for different health reasons.
Right. For managing diabetes, sometimes inflammatory bowel disease, even things like bipolar disorder, it's becoming much more common.
And if their cholesterol shoots up, you can see why their doctors might get concerned based on the standard guidelines.
Exactly. There's often that immediate assumption. High cholesterol equals high risk. Full stop.
But this research suggests maybe we need to pause before jumping to that conclusion in this specific scenario.
Precisely. And it builds on earlier work from the same team, which indicated that these LMHR individuals actually had similar levels of coronary plaque compared to a matched group with, normal LDL levels.
So it's consistent then. Dr. Matthew Budoff, one of the study authors, made a really interesting point about this, didn't he?
He did. He emphasized the need for personalized, data-driven approaches.
Can you remind us what he said?
Yeah, he basically said clinicians and the public need to know that risk assessment should be tailored. He said the existence of this phenotype suggests that alternative markers or tests should be used to establish metabolic health in some cases.
Which really drives home that point.
Yeah.
Look beyond just the standard cholesterol numbers, especially in this context.
It really does. And again, the study isn't throwing out the entire lipid hypothesis for everyone.
Right.
It's highlighting a specific group where maybe ApoB and LDL aren't the main villains driving the risk.
So the call is for a broader assessment.
Yeah, a more personalized cardiovascular disease risk assessment. And maybe if someone fits this LMHR profile, high LDL, high HDL, low triglycerides on keto, maybe prioritizing something like cardiac imaging makes sense.
It's also interesting that this wasn't just one university group working alone.
No, it was quite collaborative. Researchers from different institutions were involved.
And independent researchers too, right? Like
Yeah.
Nick Norwitz, Dr. Adrian Sotomoda, Dave Feldman.
That's right. And Dave Feldman's Citizen Science Foundation was involved, which actually helped get the study funded through crowdfunding.
That citizen science angle is fascinating. Does bringing in those different perspectives, even from outside traditional academia, help challenge established ideas like this?
I think it absolutely can. When you question long-held beliefs, diverse input is often really valuable. It brings fresh eyes, different questions.
Yeah.
And the fact that citizen science played a role here, it kind of highlights this growing public interest in more personalized, data-driven health information.
And getting it published in a major cardiology journal like JCC, Advances gives it that scientific credibility.
Definitely. The title itself is quite provocative. Plaque begets plaque, ApoB does not. It signals the key finding pretty clearly for clinicians to consider.
Okay, so let's try and boil this down. For everyone listening, what's the main thing they should take away from this deep dive?
I think the key takeaway is this. If you happen to be someone who is metabolically healthy, you've been on a long-term keto diet, and your cholesterol, specifically LDL and ApoB, has gone up. Those high numbers on their own might not be telling you the whole story about your actual heart disease risk. Context matters.
The context of overall metabolic health seems crucial.
Hugely important. How your body is functioning metabolically overall seems to significantly influence what those high cholesterol levels actually mean for you.
It really underscores the need to look at the big picture of health, doesn't it? Not just one or two numbers in isolation.
Exactly.
Yeah.
Especially when significant dietary changes are involved, like shifting to keto. You have to interpret the numbers within that new metabolic context.
So this research leaves us with a pretty provocative thought to mull over.
It does.
Given these findings, how might our whole understanding of cholesterol and heart health need to evolve?
That's the big question, isn't it? What new questions should individuals, maybe people listening right now, and their doctors be asking?
Perhaps focusing more on direct measures of artery health in certain situations.
Maybe. Perhaps moving towards a much more tailored, individualized approach to figuring out someone's actual cardiovascular risk beyond just the standard lipid panel in some cases.
It definitely gives us all something important to think about and discuss further.